Hi, welcome back to Triangles of Neck. And further we shall continue with the digastric triangle, which is also a part of anterior triangle of neck. Digastric triangle is otherwise called as submental triangle. So we can see it is bounded anteriorly by anterior belly of digastric, posteriorly by posterior belly of digastric and stylohyoid muscle. And the base of the triangle is formed by the base of the mandible and imaginary line from the angle of mandible to the mastoid process. This forms the base of digastric triangle. And apex is towards the hyoid bone. It is pulled down towards the hyoid bone. So this triangle is the digastric triangle. The floor of the triangle anteriorly it is mainly formed by mylohyoid. We can see mylohyoid muscle here, which forms the anterior part, the floor of anterior part of digastric triangle. So let's see the superficial structures, that is the structures forming the roof. So the superficial structures are the skin, then superficial fascia containing platysma muscles. We can see the platysma muscle, which is supplied by cervical branch of facial nerve, and also ascending branch of transverse or anterior cutaneous nerve of neck, and the deep fascia in the neck. These are the structures forming the roof of digastric triangle. So the roof is formed by the skin, superficial fascia containing platysma, and which is supplied by cervical branch of facial nerve, and deep fascia, and also some cutaneous nerves like transverse and anterior cutaneous nerves of neck. So that was about the roof boundaries. Next we shall see the contents of digastric triangle. So the contents of the digastric triangle we can divide into superficial to the mylohyoid, the structures anteriorly superficial to the mylohyoid and posteriorly superficial to the hyoglossus, and still more posteriorly superficial to the constrictor muscles. So the anterior part, superficial to the mylohyoid, the contents are the superficial part of submandibular gland. We can see this yellow one is the submandibular salivary gland, and facial vein. We can see the facial vein, which is grooving along with the facial artery here, grooving the submandibular gland. And facial artery, we can see it is grooving and winding round the mandible and coming superficially. So facial artery, facial vein, and submandibular lymph nodes, mylohyoid vessels and nerves, and submental artery. These are the structures: mylohyoid vessels and nerves and submental artery. These are the structures superficial to mylohyoid muscle. So mylohyoid forms the floor of anterior part of the digastric triangle, and contents of the anterior part of digastric triangle are submandibular salivary gland, submandibular lymph nodes, facial artery and vein, and it also contains mylohyoid vessels and nerves, submental artery. So that is about. Next we shall see the structures superficial to hyoglossus. Superficial to hyoglossus, here in the middle part. So the middle part, the floor is formed by hyoglossus muscle, and the superficial to the hyoglossus we can see again submandibular salivary gland. Here is the hypoglossal nerve and hyoglossus muscle. So this is the submandibular salivary gland, and it also contains the hypoglossal nerve. We can see the hypoglossal nerve as the content. So these are the structures superficial to hyoglossus. Even the intermediate tendon of digastric is also superficial to hyoglossus. Next, the posterior part of the submandibular triangle, the superficial to lower part of the parotid. Superficial to the lower part of the parotid, the structures are external carotid artery. We can see here external carotid artery giving rise to the branches, external carotid artery, and deeper structures are the styloid process and structures attached to the styloid process like styloglossus muscle, which goes to the tongue, and stylohyoid, which is towards the hyoid bone. This is stylohyoid, and stylopharyngeus muscle, and the ligaments are stylohyoid and stylomandibular ligaments. These are the structures attached to the styloid process, which are present on the posterior most aspect of submandibular triangle. And also submandibular triangle contains glossopharyngeal nerve and pharyngeal branch of vagus nerve and part of parotid gland in the posterior part. Glossopharyngeal nerve here medial to the styloid process, then pharyngeal branch of vagus and part of parotid gland. The deepest structures are the internal carotid artery. We can see that still deeper to the styloid process are the internal carotid artery, internal jugular vein, internal carotid artery, internal jugular vein, and vagus nerve between these two structures. So this completes the contents of digastric triangle. So anteriorly superficial to mylohyoid, middle superficial to hypoglossal, posteriorly superficial to superior constrictor of pharynx, and posterior most the floor is formed by superior constrictor of pharynx. And we have studied like structures superficially, then structures present deep in the posterior most part of the triangle. Okay. So let's see few questions about the digastric triangle. All is true about the digastric triangle except. So on it is present on the either side of the anterior belly of digastric. Floor is formed by mylohyoid. Floor is formed by hyoglossus muscle and contains mylohyoid nerves and vessels. So answer is it is and either side of anterior belly of digastric. It is between the anterior and posterior belly of digastric. So in here are the structures superficial to mylohyoid in the anterior digastric triangle except. So the answer is we can see superficial part of submandibular, it is superficial. Hypoglossal nerve is superficial. Part of parotid gland is not superficial to mylohyoid, it is in the posterior part. So answer is C. And mylohyoid artery and nerve are also not superficial to mylohyoid, they go deep to the mylohyoid. So answer is C and D.